Thank you for joining us here on the NPTE Final Frontier podcast. My name is David.
And my name is Emily. Today, we are diving into a very important topic, and that topic is imposter syndrome. What it is, how it shows up in physical therapy training and practice, and what you can do to work through it. So, first, let's touch upon what even is imposter syndrome. The definition of imposter syndrome is that imposter syndrome is a physiological pattern where individuals doubt their skills, talents, or accomplishments and fears, being exposed as a fraud despite evident success. This was first coined in the 1970s. And I just want to touch upon that again. What's important to note is that with imposter syndrome, this is when there is fear about being exposed as a fraud despite evident success. And don't forget that word success. Now, some key traits include feeling like you've just gotten lucky rather than you've earned your success, downplaying your achievements, making excuses as to why maybe you got this goal or achievement over somebody else, instead of just recognizing that you deserved this achievement. Fear of being found out, like someone is going to recognize you like you have been doing things wrong all along. Overworking or perfectionism to try to compensate. And then finally, comparing yourself to peers on a constant basis.
Now, you may be listening and putting yourself in the position and being like, wow, I could feel that way too. And I've been thinking that way. So, I'm going to talk to you a little bit about the red flags that you should notice whether you are a PT or a PTA student or a new grad or you're currently practicing. So, besides the ones that Emily was talking about, some things would be like you feel like you don't belong in the clinical rotation or even in your job position. Maybe you're seeing your caseload and you're like, no, why, how? Why am I here? This patient just got out of this sort of a surgery and I am going to be seeing them? I'm not ready for this. Or maybe you're a little bit hesitant to speak up and ask questions about anything out of fear. Maybe you have a fear of sounding stupid or even incorrect. Sometimes you may even pass your NPTE, but then you could still feel like you don't know enough, that there's still so much to be out there, and you're just feeling really dumb that you don't know this stuff. You attribute a lot of this success to external factors such as luck, or even maybe you got through a clinical rotation and you put a lot of it towards your mentors or your CI and be like, I had a really great mentor, a really great CI. That's why I got through this. It wasn't honest. I couldn't do it on my own. It was really a lot of them. It was also a lot of you. Something else, you over prepare for evaluations, fearing that you're going to be exposed to a patient. You know enough. You're in there for a reason. Something else is comparing yourself to others around you, such as your classmates and your coworkers, and fearing that you're going to fall short in your mind to whatever they're doing, and in comparison, that you're not going to live up to it.
And now, going off what David just said, it's okay to recognize that you got to where you are today because of help from your CI, or that you passed your MPTE, but there's still more to learn. Those are all normal feelings, and we should be striving for more. We can attribute some of our successes to our professors or our CIs, and that's not specifically what David is talking about, right? What David is talking about is simply thinking others did this, not recognizing that we played a role in these successes, making excuses or reasons as to why we didn't actually do the right thing in the first place. So don't forget that. Now, if you are suffering from imposter syndrome, now let's discuss how to overcome it, because that is so important for us to know, well, how can we tackle this head on? And the first thing is to name it and normalize it. Recognize this, it's common. especially in the healthcare field where responsibility is high, right? We want to protect our patients. We want to give them the best care possible. So it's normal for us to hold ourselves to a higher standard. Track your wins. Keep a confidence journal. Recognize I passed that NPTE. My patient is feeling better after their evaluation. They're doing their home exercise program that I created, and they're having significant pain relief or improvement in function. Our patient positive feedback. Maybe our patients are ranting and raving about how well we're providing their care and how much they love coming to physical therapy. Write these things down. Keep that confidence journal so when we start to feel some of that imposter syndrome creeping in, you can go back and reflect on some of these positive wins and talk about it, right? You have peer support. Peer support is powerful. There's often times that others in the same room as you, maybe the same program you went to, have the same feelings. So it's okay to talk about and confide in one another, to talk about your own experiences and maybe learn some other ways to overcome it with those next to you.
And I'm going to add that if you do talk about it, and maybe those people around you don't want to listen, or maybe they're just not being open to listening to you, then those are not the people that you want to be around, period. If you are not surrounding yourself by those that want to listen to you, please find somebody that is willing to listen to you, whether it's a friend, a family member, or even getting yourself into therapy to talk about it. There is nothing wrong with it. It's very normal, and it's okay to talk about how you're feeling. So something else that we want to talk about, talking, reframing your self-talk, right? Talking to others is great, but talking to yourself is so important because you're going to be listening to yourself as well. So instead of saying, I'm not good enough anymore, say, I'm still learning, and recognize what you have learned. Also, feedback is data. It's not just judgment. So if you're doing an evaluation and one of your coworkers gives you feedback on something, don't take that as an attack. They're not attacking you. Take it as a growth opportunity and look at yourself in your evaluation and be like, okay, I could do that better. And guess what? Maybe they say something. It doesn't even have to be about evaluation. Maybe you get some external feedback, and maybe it's incorrect external feedback. Okay, you recognize that it's external feedback and it's incorrect, but take it, be open to it. Don't just shrug it off and do not take any of it too hard. If anybody is saying anything to directly impact your emotions and feelings and hurt you, then I think that you have to remain in control and do not let them have that power over you. Because once you allow somebody to have power over you with their words and actions, then they have power over your mind. Once they have power over your mind, they can control you so much and you lose control. So remain in control. Something else I want to mention was mentorship. Mentorship can help out so much. So find mentors that can validate your experiences and remind you of your progress. These mentors, it could be a friend, a colleague, it could be somebody within Final Frontier. Whatever it is, find your mentorship out there. And as I mentioned before, if you need to, seek out some professional therapy or coaching. There's nothing wrong with it, especially if it's affecting your well-being, your performance, and your life. You matter and you are very important. So please get that help.
Great. Now let's talk about a few more key talking points. And we're going to dive into a few different scenarios. First, let's think about PT students. If you are a PT student, remember, you are not expected to know everything. This is throughout your schoolwork. This is throughout your clinicals. This is while you are preparing for the NPTE. Remember, you are not expected to know everything. That is what learning is for. So, going back to what David had touched upon earlier, it's normal to want to grow more, maybe not be fully confident in ourselves with every topic or every item. That is what growth is for. As students, we are not expected and we shouldn't feel like we know everything. If we do feel like we know everything, I think And that's a little bit more of a problem that might be a whole nother episode for us to discuss. But there is room for growth always. So that is not considered imposter syndrome. We should be wanting to grow more. Now, if you are a new grad, you may feel like you're not ready. Many do. That feeling does not necessarily mean it's true. You are ready. Your professors, your program passed you to get to this point. They would not do that if you were not ready. They have faith in you, so it's time for you to have faith in yourself. Remember, trust the process and trust yourself.
And I'm going to just add in a few other times that this could come up, especially, let's say, PTAs. We value PTA so much, and you have to value yourself. And sometimes you may come across that feeling of, you know what, I am a PTA, I'm not a PT, so I'm less qualified to do my job compared to a PT. No, your role as a PTA is very important, and your scope is very vital. In that clinic, you are relied upon a lot and trusted a lot, exactly for that reason. So, don't psych yourself out of that. You've earned your place right there, and you're doing amazing. Also, after you pass your NPTE and let's say you start working, you may not feel like a real clinician right away. It's going to take time, confidence, repetition, repetition, repetition. Yeah, and repetition over and over and over. Once you pass your examination and you start your job, it's not going to hit you right away. It's going to take time, but you're going to get there.
Now, I cannot reiterate the importance of what I am about to say next. So if you are listening, listen up. Imposter syndrome does not mean you are broken. It means you're growing. Just because you're feeling certain ways or having certain thoughts or emotions about some self doubt, that doesn't necessarily mean you have imposter syndrome. Many of these feelings can be a common feeling at times. So it's important for us to recognize these feelings. And is this just us growing? Or is it truly imposter's syndrome? Don't forget, you've made it this far for a reason. I'll say it again, trust the process and trust yourself. You do not have to be perfect to be impactful. You do not have to be perfect to be successful. And don't forget that.
All right. Now that you heard our podcast, here is a quote from Maya Angelou. I have written 11 books, but each time I think, uh-oh, they're going to find out now. I've run a game on everybody, and they're going to find me out. That is a quote from Maya Angelou, and we know how valuable and impactful she was. So, it is okay. You are not alone. There's many people out there that do feel very similar to how you feel. It is common. It is normal. So, we should be normalizing it. And guess what? Look at the impact that she had on society. You have that same ability to have that same impact on society. So leave your mark. You may be doubting yourself, but there's many people out there that don't doubt you, and many people out there that will listen to you and trust you. So, it's time that you trusted yourself. You are powerful, you are strong, you are a final frontier warrior, you will pass.
Thank you very much for listening. For more information on NPTE Final Frontier, please visit npteff.com. You can check out all of our social media platforms such as Facebook, Instagram, X, and TikTok.
Till next time, have a great day and a powerful tomorrow.